Hi, I'm Dr. Steve Pearlstein, and this is Second Opinion. Today we're going to talk about sprains and strains. You know, the thing about sprains and strains is we usually think of them as almost a non-injury, just something that'll heal fast and be done with, and it doesn't really have any kind of, consequences for the future. But we're going to expose the myth of that and provide some very helpful information for you so you can understand sprains and strains in a new light. So first, let's define them. Well, strain, that's with a T, S-T-R-A-I-N, is an injury to a muscle. And sprain, that's with the P, S-P-R-A-I-N, is an injury to a ligament. So these injuries are really two different injuries. We usually lump them together and we use the terms interchangeably, but they are two different injuries because they involve two different types of soft tissue. Now, muscle, we all know muscle. Muscle is soft and pliable and actually has a fair amount of stretch. Excuse me. And ligament is tough and fibrous and does not have much stretch. Well, ligaments attach bone to bone, and muscles attach to bone via tendon. So those are the fundamental differences of the materials involved in sprain and strain injuries. I want to draw your attention to this picture here, which is a picture of a shoulder, and then the shoulder in relation to the rest of the body. And it really shows all the components that we were just talking about, including one that I haven't mentioned yet. So you can see the red muscle there. That's a bicep muscle in the arm. And it attaches to bone, but it does it through a tendon. So coming off the top of that muscle is a white line of something. That's the tendon, and the tendon is what attaches to the bone. Excuse me. And the ligaments, which are up to the right and above, there's 4 of them. These attach bone to bone. So they have different functions. The ligaments protect the integrity of joint structures, and they make sure that joint structures don't go awry. They don't move more than they're supposed to. So there's a real great integrity, especially, for example, in the spine, where each vertebrae is held in check by ligaments which connect bone to bone. And when you move and bend, they make sure that there's balance and alignment and proper functionality when they do that. Muscles, on the other hand, of course, are broader, larger pieces of soft tissue. And if you flex your arm up like this, it's the muscle that's contracting. And the tendon is acting as the tough fibrous tissue that protects the muscle and attaches to the bone. It also shortens and it maintains the integrity of the whole joint motion. Because if muscle was attached directly to bone, it wouldn't be as strong and it wouldn't be as sturdy. So those are the different types of soft tissue, and therefore we have the different types of injury. I want to draw your attention, I want to focus on sprains for a moment. I want to draw your attention to the picture here, which is of an ankle. And what goes without saying, but it's important, the ankle is attached to the leg. Well, how does it do that? There's a number of ways, but in this picture we're looking at certain ligaments. And you can see there's a long name down the bottom, calcaneofibular ligament. That tells you the two parts that they attach to. The calcaneus is the heel bone, and the fibula refers to the fibula, or the bone on the outside side of your leg. So there's a connection between the two by a ligament. And that's, as I said, a tough fibrous tissue that maintains the integrity when we bend and twist our ankle. Very important. There's other ligaments too. There's a whole bunch of ligaments in there, and they're all very important. Unfortunately, they're easily sprained, as in an ankle sprain. And you can see that there's different grades of sprain, and you can even get a complete tear, which probably requires surgery. But the different grades of sprain are the different degrees of tearing. Ligaments, as I said, don't stretch very much, and so they easily tear. And the thing about ligaments is that they scar. So that's one of the things about the long-term effects of sprain injuries, that they're not as simple as one would believe, and there can be after effects. There can be down the line many years, which mimics the aging process, loss of flexibility, loss of mobility in various joints. Keeping in mind that these soft tissues are attached to bones, are attached to joints. And that's the big point that I want to make about the long-term effects of these injuries. Although I said that muscles heal very well, and all of this needs to be rehabilitated, even the simple strains. The fact that they are attached to the bones, when you think of a strain or a sprain, you're probably going to think of a wrenching type of injury, a sudden injury, and all the attention is focused on the soft tissues, and almost nothing is focused on the bones, the joints themselves. Well, in the chiropractic profession, and I am a chiropractic physician for many years, when someone comes in with a strain or a sprain injury, I'm very mindful of, we got to check the functioning of the bones that these soft tissues are attached to, because there might have been an adverse effect to the bones, to the joints, just from the wrenching aspect of the strain or sprain injury themselves. So the point is that usually these soft tissue injuries are only looked at as just soft tissue injuries. To a chiropractor, they're looked at as more than just a soft tissue injury because of their relationship to the joints and the bones that they're attached to. And that's very, very important. So if a sprain or strain injury, especially a moderate to severe one, if the rehabilitation treatment is just focused on the soft tissues, yes, there will be healing, yes, there will be improvement, but either at the time there might be incomplete improvement, or down the line you get what I see in my office all the time, where people have a breakdown into pain of a certain joint area and they just don't understand why, because they haven't done a thing. Yet in their history, there are either injuries that they recollect, or more commonly, there is no recollection of the many different sprains and strains that we've all suffered since we were little kids. So there are complications. There can be complications, to be more accurate. There can be complications. It's just that there usually are to sprain and strain injuries. That's why it's very important to treat them properly. And how to treat injuries of this nature, sprains and strains, is seen in a video in which I explain how to treat injuries from exercise. Really the same thing. We're talking about sprains and strains, and how to deal with them, how to treat acute injuries like this. And that would help either prevent or mitigate the further long-term damages from these injuries. So I hope that you have learned that a sprain and strain is more than just a simple, common everyday injury that'll just go away by itself and nothing to be concerned about. Hope the video has been educational and informative. If you're watching this on one of the venues where this is, please like and comment on it. I'd love for you to subscribe to my YouTube channel. That's a Santa Fe Family Chiropractic Center of Santa Fe YouTube channel. All the information is at the end of this video. And this is part of a video series. The Second Opinion video series focuses on topics like fitness and wealth and exercise and health and chiropractic. Lots of topics that I've done. I would love to know, is there a topic that you would like me to talk about? Because more than likely I've either done it or I will do it. I'm doing this is an ongoing series, and they'll be showing up on the different venues, Facebook, YouTube, and on my website every 2-3 weeks, that kind of frequency. So again, I hope that you've gotten a lot out of this video and that it's been informative for you. I'm Dr. Steve Pearlstein, and this has been Second Opinion.